than to have some of the most esteemed experts on Black wellness to talk to you. And the great news is that I get the opportunity to introduce one of my predecessors, someone who has been visionary during her time at the League, and also even since and before her time at the League. Cheryle Jackson, a person who has developed her own path in Black wellness now as a CEO, but also who has talked about Black business, Black medicine, and what it means to really be well and to do good things. So she will be our moderator today, and please join me in welcoming back to the Urban League, Cheryle Jackson.
A great job as CEO of the Chicago Urban League. Where she says to go, I shall always follow. So once an urban leaguer, always an urban leaguer. I'm CEO of MyOwnDoctor. MyOwnDoctor is a culturally provides culturally relevant care and information. So basically, we connect people with Black and brown doctors. We have two portals. One is called Black Telehealth. The other is called Latinx Telehealth. So we're in this to really address the issues that we're going to be talking about today. Why are Black folks so far behind and suffering in the health space? So, as a way to get started, I want to ask you a couple questions. Who really is angry about the need for police reform? I mean, does that just get your goat? Raise your hand.
Yes.
How they're targeting Black folks. Okay. Who is upset by how they're trying to take the right to vote from Black people? Who's upset about that? Who's upset about that? Who's angry about how Black children are undereducated and put in, right? Are you really, those things fire you up, right? Yes.
Yes.
Well, you need to be equally fired up about health. Because it's the same thing. It's the exact same thing. They're disenfranchised. The same drivers that drive the need for police reform, the poor education of Black and brown children, the challenges to your rights to vote are the very same issues why Black people are struggling with our health and wellness. It comes down to racism.
Yes.
And access. So I just want, let's level set, okay, as we have. So I want y'all to lean into this conversation, take advantage of this information, and I want you to be fired up and stay fired up about this one thing. Who in this room feels like they have a right to good health? Okay, everybody raise their hand on that. Sometimes we normalize not feeling good. We normalize high blood pressure. We normalize diabetes. We normalize I'm not going to have access to quality of care, good quality. We normalize that, and we need to stop that because you have a right to good health. So let today be the first day that you are claiming your right to feel good. So with that, I'd like to introduce the panel. We're here to talk about why the importance of having a Black provider, doctor, therapist, mental health specialist, nurse, what the importance of having a Black doctor and other health providers in your life, and how it impacts the quality of your life and the life expectancy, how long you will live. So with that, I want to quickly introduce our panelists, and I will start to my left the very end, and have each of you say who you are and what your specialty is. And then tell everybody how you're feeling, because you all are usually asking other people how they feel. We want to know how you feel. So tell us how you're feeling.
Good afternoon. I don't think I need it. Good afternoon, everyone. I am.
Do you need it for recording?
Oh, okay.
Okay.
I'm sorry. Good afternoon. I am Damian McGhee. I'm a pediatrician, so I see kids of all ages in the city, from birth all the way through college. I'm in a practice. It's called Donohoe Pediatrics. It's a little further north, but I also volunteer in Woodlawn at a place called Hello Baby every first Monday, where I am present to answer questions for any caregivers free of care. So you can always catch me at Hello Baby in Woodlawn every first Monday. I hope everyone is feeling well. I'm feeling blessed. I'm lucky to be here and have this opportunity to come out and meet some great folks today.
Wonderful. And we're going to ask everybody to go ahead and put a hand on that. You said Damian, Dr. Damian.
Dr.
Okay, put a hand. You
Damian.
worked hard for that, doctor. Okay, so put a hand on that.
Hi, I am Dr. Toya, since I need to put a hand on
Put a
that.
hand on.
I am a therapist and also assistant professor at Chicago State University. I am the owner of Essence of Healing, where I provide telehealth to adults and as well as adolescents. And today I'm feeling really blessed. Somebody blessed me with this opportunity, so I'm very happy to be here and to share knowledge and to hear from our community.
Awesome. Now, we want y'all to be real honest about how you're feeling. We know you're blessed, okay? So, if you're feeling crazy today, that's okay too, okay? Share that.
Thank you. Hello, everyone. My name is Dr. Walker. I am the Senior Medical Director of Value-Based Care at Rush Health. I'm also Assistant Professor in the Emergency Department. My background is in public health and emergency medicine. So, served as Deputy Director at IDPH, so many of you may have heard of me or heard me talking to you about getting vaccinated, and also recently finished the White House Fellowship. I was a Senior Advisor to the Surgeon General. I feel rushed a little bit.
Keep it real here.
I squeezed in a birthday party with my 4-year-old, so but it feels good to get that out of the way and be here with you all, and also get back to them a little bit later.
Awesome.
Good afternoon. I'm Dr. Crystal Strickland. I feel thankful to be here. I was excited to be invited to share with you guys this afternoon. I am a business owner, president of our private practice. I'm an obstetrician, gynecologist, so I see women, I deliver babies, I do women's surgery, and I'm in a partnership of 4. We have 2 midwives, we have nurse practitioners, so it's pretty busy. And we also contract out with 2 of the community health centers in our area, North Shore Health Center and Health Link, where we kind of reach out to the community. Again, I am thankful, and I feel a little pressed because I'm on call. But it's been pretty good.
See, are we keeping it real?
Yes,
Like
we
that.
hope that it continues to be calm because I'm enjoying being here. Thank you.
Is it afternoon? Oh, good afternoon, everyone. My name is Dr. Ansel Johnson. I am an optometrist. What we do in our office, well, I've been in private practice since 1990 in Blue Island, 128th and Western. And what we do, we're not just an eyeglass place. We connect the dots between your eye health, your general health, and your vision. And we explain to people every day that it's all connected. We are the only eye care facility, the first eye care facility that had its own certified diabetes education program. So we are very serious about everyone's overall health as well as their vision. And again, we relate all of that. We also are the only program in the South area that has a myopia management program where our children are becoming more and more nearsighted because of the computer work, online learning, and we're seeing their eyes get worse and worse every year. Now we have the technology to do something about that. And I've been honored with being in Black Enterprise on 2 occasions as one of America's 101 top African-American doctors.
All right.
So we do a lot of things. We've been around for a long time, and it's such a blessing to share this knowledge with them. I get excited when I have the opportunity to speak to the public because there are so many questions. And you know, I said we're doctors from the community, in the community, and how I feel right now.
Yes.
I'm pressed too. Because I had to get up, load up the car, bring our screening stuff here. I barely ran in here. They called me and I'm screening somebody in the back with eyes. And now after I leave here, I have to go look after my 93-year-old mom to make sure she's okay.
That's right.
So it's like, sometimes we forget we're human too.
You're human too, and that's
We're
why I
human
asked
also.
the question.
And so-
Y'all want to take another shot at how you feeling? Any pressed people out there? Anybody feeling pressed, stressed? Okay, if I had 4 hands, I'd raise them all, okay? I just hopped off of a plane this morning about an hour ago, but I'm excited to be here with you all. I started a conversation about helping you understand that they call it health disparities, you know, the gap between how non-Black people are, their health status, and Black people and brown people's health status. There's a big gap. We're not doing so great. That it is embedded in structural racism. That's why I started the way that I started. I want you to fully lean into that. Let me give you a few quick stats to help you understand what I'm talking about. The life expectancy gap between Black and non-Black Chicagoans is 9.2 years. So Black people will live 9.2 years less than everyone else. Let that sink in. The diabetes-related death rate among Blacks is 70% higher than among non-Blacks. And while this isn't on the sheet, I happen to know it, the amputation rate, amputating our limbs, what is it tomorrow, about 5 to 7%?
I think it's 4 times higher.
4 times higher. 4 times higher than everyone else. And a lot of that is avoidable. The homicide rate among Blacks is 9 times higher than the homicide rate among non-Blacks. Do you understand that the homicide rate, the gun violence, is a public health issue? They want to make it something else, but it's a public health issue, plus a lot of other issues. Education, all that, I talked about structural racism built into everything. Yeah, add all that up, and that certainly helps explain the homicide rate. Black infants are almost 3 times as likely to die in their first year of life compared to non-Blacks. This isn't on the list, but I do want to include, I know Dr. Crystal, you're going to talk about this, the Black maternal health and mortality rate. For Black women, we're more likely to die, irrespective of education, money. Your money can't save you from this. Your education can't save you from this. Your celebrity status can't save you from this. Black women are 7 times more like in Illinois, 3 times or 3 or 4 times nationally more likely to die than non-white mothers nationally, but in Illinois is 7 times higher. And nothing can save you. Go talk to Serena Williams. She'll tell you all about it. Nothing can save you from this. So what's the common factor in all of this? Black people account for half of the people living with HIV. And then the opiate-related overdose death rate among Blacks is more than 3 times the rate among non-Blacks. So we've got a problem. And how do we close that gap? And that's what this panel is about. And my Black doctors and nurses and optometrists and other providers are so important to this process. So I'm going to start with a question. And instead of assigning you all the questions, I want you to say, let me know who wants to answer the question. And if you all don't follow instructions, then we'll start assigning, okay? We'll play nice at first. Pressure. I'm like, look, they already told me they stressed out. Okay, I'm about to stress them out further. This is an easy one to start with. What inspired you to work in healthcare? Did you have a Black doctor or clinician as a role model growing up? So who wants to answer that question? Yes.
One of the things that, well, in school, I like math and science, and I like people. So to me, one of the best combinations of that is, healthcare, being a doctor of some sort. It wasn't until college I decided what I wanted to do in terms of optometry. I'm kind of a techie, nerdy person, so I like all the different gadgets and high-tech things we have, and then integrating with people vision. I mean, we help people every day, change lives every day by enhancing what they do day to day. One of the little snippets that got me into that is just understanding at that time, there were probably only about 400 African-American optometrists in the country at the time. Now there's probably less than 1,000. We talk about social determinants of health, and it's all about access and education. So Chicago area, the south side, south suburbs are almost void of independent eye care providers. Dr. Patty Davis is here, one of the very few people in the whole world that's a neuro-ophthalmologist and pediatric optometrist.
Can you wave your hand?
She was in here.
Just walk out. Okay.
So I have to give her a shout out. My associate, Dr. Shannon, who's running our myopia management program, the very first optometric resident at the University of Chicago. So there's not a lot of access because we're not out here. We're not replacing each other. So that's one of the, but again, I look at it as an opportunity. And we have to support our Black doctors out here in various professions. So we need your support too. So seek us out. I mean, studies show that Black people do better. It's documented. It's controlled study after controlled study. So there's no doubt about that. So we need to seek each other out. And, that's pretty.
Any role models? I mean, it was only 400.
My initial role model was Plano Child Development Center. Been here for years. Dr. Robert Johnson, no relation, Dr. Stephanie Johnson, who still runs the practice. They were my first exposure to people that do eye care that look like me.
Yes.
So, it's hard to be what you haven't seen.
That's right.
So that was my first exposure, and I'm just trying to help play it forward like Dr. Stephanie Johnson is, and a few others that are still out here.
Dr. Stephanie, you want to take a stab at that? I'm sorry, Crystal,
Okay.
Dr. Crystal.
It's okay. Yeah, so sure. I mean, my road to being a physician is a little different. I'm from a very small town. I actually was born in Arkansas.
All right, let's
Yeah,
see the girls.
it was out. Yeah, so, it was population 20,000 or less, and my aunt's neighbor was a Black pediatrician. Her name's Dr. Abraham. And so she was like one of the first people I ever saw. I was like, wow, maybe I could be, a doctor. And then moving on, I got interested in the health field, went to college, etc. And then was kind of just trying to decide what I wanted to do as far as being a physician. And I decided on medical school, and then I did an elective at University of Chicago. And then Dr. Anita Blanchard actually helped me get that elective. And when I was there, I just saw the support and everything that I could, achieve. And then I got really interested in women's health care. And then from there, I chartered my course. So I think it's important to know that seeing people that look like you, that are successful, definitely charters your course. And so it even goes down to if you walk into a doctor's office and all you see are maybe people who are not Black or not, they don't look like you may or may not feel comfortable. So it starts with the receptionist that's in your office, to the people that take you back, with your medical assistants, to, the people at checkout, and of course your provider. People are going to be comfortable, okay, and then they will open up more and actually reveal more of their health problems and concerns when they are surrounded by people who are of their background where they feel like they can relate. I just think it's important to realize that, and it all circles around to even how I became interested in being a physician. Kind of all relates back to where you come from and where you're used to, and people that you can see that maybe look like you.
Awesome, thank you. Dr. Garth, I'm calling each of these physicians by their first names while putting a handle on it, so.
That's okay. So I was fortunate enough to have a lot of exposure. I had an older brother who's about 19 years older than me. When I was in undergrad, he was currently going through residency. Up until that point, my identity was mostly tied to sports. So I hooped at Woody Young, I hooped all throughout the city. I was recruited to Purdue to do track and football. Usually what I say is that I was concussed into medicine. The person who was ahead of me was a guy named Bernard Pollard, a Pro Bowler. He was about 3/10 faster than me, had 10-inch more vertical than me. And I think I just looked across the field, I was like, I gotta do something different. I pursued economics, and I loved that study, and I knew that you can do something in addition to studying for the medical sciences. So when I think about social determinants of health, a lot of my foundation is based in terms of my studies around economics and thinking about incentives and thinking about economic equity and thinking about a lot of the history that explains why there are such large healthcare disparities. And during that time, I became very familiar with thinking about social and economic barriers. I didn't necessarily know what social determinants of health was, but as soon as I got into medical school, I pretty much committed a lot of my work to addressing those issues, whether it be research, whether it be the organizations that I'm involved with at Student National Medical Association, whether it be the organizations I partner with. I found that to be so interwoven in terms of the outcomes of our community. And that essentially has led to a lot of the things that I focus on to today. I think we hit on a lot of those themes in terms of the importance of being able to touch and feel and be proximal to somebody that looks like you, who is and has achieved the ability to become a doctor or whatever field that is. And I think that it's so important that we all stay proximal and be able to expose our youth to as much as they can, especially at younger ages.
So you're a medical doctor and an emergency room physician at Rush Hospital?
Yes.
Okay. Rush University Medical Center, I'll say that. Awesome. Now I'll turn to Dr. Toya and just tell us what kind of practice or doctor you are and what motivated you.
So I am a therapist by education, by trade. What kind of got me into this particular setting was that just having family members that struggle with mental health issues, being able to see that firsthand, seeing the limited access that they had, also kind of just made me think more about mental health in that way, trying to educate my family members on what it means to be a person that has a mental health illness, and also wanting to bridge that gap. Because sometimes the thing that I have noticed when we go out into the community, when we're trying to get information, we get redlined. People are not giving us all the information that we need. And so what happens, we get tired of going to place, we just stop. And it's just like, you know what, I give up at this point. And so I felt like, hey, let me come along and try to be the bridge for those people, to give them that access to be able to educate people in a way that they understand. Because sometimes, let's be honest, some people can be condescending when they're talking to people of color. They don't fully explain things that go on with their family members or with the individuals themselves. And so I always thought it was important, especially in mental health, since they like to overdiagnose us in the mental health field, to have a provider that looks like the person in which they serve. And so in many cases, a lot of Black and brown people are going to facilities where their provider does not look like them. They are not from your community. They do not understand the issues that you are currently experiencing. And so a lot of things get overlooked. And so that's why I decided to go into this field. And unfortunately for me, I've never seen a Black therapist when I was younger. And so for me, it was everything I saw on TV. They were older white men whose patients were white people. And so I'm like, I know we have some struggles as well. Who are we seeing? Who are we turning to for? Right. And so who are we seeing for assistance?
Right.
And are we getting proper care?
That's right.
So that's what led me here.
That's awesome, and we're gonna talk a little more about that later. Okay, Dr. Damian, tell us about what do you practice, what kind of medicine you practice, and what motivated you in my field?
Growing up, I did not see any doctors that looked like me, and my sister and I were first generation college graduates in our family, so it was definitely not what we saw. We weren't, I never had a doctor or a dentist or a nurse even that I can remember that looked like me. And in school, I remember pretty early, like junior high school, science was my thing, right? So I'm like, okay, what can I do with this? And I had a mom who, despite not having gone to college, was very motivated and knew that her kids could achieve more. And along the way, I had so many teachers tell me, maybe I should think about something else, right?
So they discouraged you.
They discouraged me, which is all I needed, right?
Okay,
So,
that's right.
That and my mom, she was like, oh, look at this, right?
Right.
So, and that also helped make my decision. I knew by junior high that I was going to HBCU because I'm like, all these teachers keep telling me, well, you would be a great teacher. And teachers are amazing and that's a difficult job, but that's not what I want to do. Right, so I made the decision. I had an 8-year HBCU educational
Which
career.
HBCU?
I went to Howard University.
HU?
HU?
You know?
All right. Our oldest is now a sophomore at Howard University.
All right.
So our kids are having a different experience. And then I went to McGhee University, McGhee Medical College, excuse me, for medical school. And it really is having support that looks like you. I knew that they would make sure, not only, it's one thing to get into medical school, we got to make sure to get out of medical school.
Oh,
We go on to
yes,
practice,
say that.
right? So I knew that support would be important. The reality is where I practice now, I'm on the north side, so the majority of my patients don't look like me, which is why I made the decision. I see 10% of my patient panel free of charge, because I was in traditional medicine for
Let's give it up for Dr. Damian for that.
I've done it all in my career. I've been doing this almost 20 years, but I want to make sure that we don't lose our focus of why we got into medicine. And my patient panel is full, so I'm not accepting new patients, but anytime I get a call, I always say, are they black? Because I keep overfilling, right? Because if it's a family of color and they have been struggling or they're not being heard somewhere, I still take them. So if there's, keep me in mind if there's ever a family that anyone knows that has some needs. I'm in a concierge model, which is very different from traditional medicine, and it gives me the privilege to spend so much more time. So I have a lot of families in my practice that need that time, wouldn't get it elsewhere, and it's just a great privilege to be provided for.
Thank you for your service. We really appreciate all of your service. So I want to talk about next, because I know one of you have to be out of here. One, who's that? You? Let's start with you then, girl. I want you to share what health disparity looks like in your practice area and how being a black doctor changes that. So for you as a pediatrician, I read the stat about newborn babies. So I'd like for you to talk about the health disparity, describe briefly the health disparity in your practice area, and talk about how seeing a black doctor changes that for a black patient experience.
That's a great question. And that stat, it's so heartbreaking, right? Our newborn babies, our babies in the NICU and in the newborn nursery have a 3 times higher mortality rate. But the interesting piece is when you look at the doctor, right? So if they have a black physician caring for that baby, that number actually drops, right? So they're 3 times more likely to survive having an African American doctor. And if you look at those studies, when you do the reverse, when a white baby has an African American doctor, that does not change their care. So we provide the same care to all of our families, no matter what they look like, but unfortunately, we don't get the reverse, right? So it's so important. I'm on staff at Lurie and Prentice, so I see babies in the newborn nursery at Prentice, and like I said, even though I'm not seeing new patients, anytime a family needs me, I know this is what we're here for, right? So I will always say, yes, I'm gonna see this, because you see the family, you see it in their eyes, they're worried, right? If anyone's a parent, it's a different kind of love and worry the moment you have a child, right? And you know that they want to make sure, they've seen these studies, right? They were on CNN, and they're like, I need you to come take care of my baby, right?
You sis.
Right.
Okay.
Yeah, and I think it's also important too, because even though there are more of us every year, looking at we also have to remember to not only care for our patients, we also have to make sure we are prepping the next generation of docs, like you kind of talked about down there. Because when I see we talk to the med students and the residents at Lurie Northwestern, there's not a lot coming out in these next few classes. So we need to make sure we don't forget what it was like being med students or trying to get into med school, and we are reaching back and kind of pulling the next generation, because we're going to need them. Right?
Your mind, this just came out, that, white, wealthy women, their babies were, say, X number of likely to pop. Let's just throw a number. I can't remember this statistic. Say that their babies were, out of 100, were 5 times, likely to die out of 100. Then they said, what is it for poor white women? And then that number climbed to, say, 8. More likely to pass. Then they went to wealthy black mothers. Their babies were 12 times more likely to die. So a wealthy white mother's baby is more likely to die than a poor white mother's baby. I just really want you all to understand this. What racism, built-in racism in the healthcare system, how it impacts us. So we're so grateful to you to providing this service, and whenever possible, taking in patients that are Black patients, to give them the care that we need and deserve. So thanks so much. And we understand when you have to tiptoe out, she's disinterested, she's got probably babies to deliver.
Well, no babies to deliver, but I gotta give my baby to a birthday party. So.
Thank you. Yes, so tell us in your practice area, what does the disparity look like and how seeing a Black therapist changes that?
So there are a couple of things that I see within the counseling field. One being the overdiagnosing of mental health. And usually what that leads to is patients being prescribed medications that they don't need, being placed in services that they don't need. So you may hear a lot of Black kids, oh, my child has ADHD. When really your kid is probably just a normal kid who's hyperactive. And they get placed on medication at a very early age that can lead to long-term effects down the road. Another thing that I tend to see is accessibility. So I have a client currently that's in a program, but she has to go to Hoffman Estates. So that's a hike coming from Grand and Pulaski to Hoffman Estates for a service. And so it makes you think, like, why is there something not in the community for this young lady to go to? And so when clients see me, the first thing they say is that you get me, you understand. Because in the field of counseling, they confuse cultural norms with mental illness. So if you have a client that tells you... Okay, you gotta say that again. Okay, breathing. So a lot of times in counseling, social norms are confused with mental health issues. So if you have a client that comes in and says, well, the Lord spoke to me and said this, I'm going to automatically say, this woman is religious, she is spiritual, I get it. Right. Where somebody else will say that she's hallucinating, she's hearing things, and she needs to be hospitalized.
That is crazy.
When you don't have an understanding of the culture, you misdiagnose and you misunderstand. And so that's why it is very important to know the people in which you serve. They cannot just be a name on a chart to you. Mm-hmm. I've gotten to the point where I'm like, is your mother's birthday coming up? Is your daughter's birthday around the corner? you really have to know the people. It doesn't startle me that someone says, you know, God spoke to me or I saw my mother, because I know where you're coming from. So I'm not quick to judge in that way. But it really does come down to understanding. Accessibility, I've seen a lot of mental health facilities close in my time of doing mental health. And so a lot of people are left without services. Or you're pretty much giving your money to another community that is not yours because that's where you're going.
Right.
So that's some of the things that I see.
And again, not enough Black mental and behavioral health providers, therapists in the field.
So I'm excited when I work for Chicago State, when I see these students, because I'm like, yes, you are going to be out here soon. And I love when I see Black men in mental health, because I'm like, my soul smiles. I'm very happy.
I like that, her soul smiles. She sees a brother in the mental health field. That's awesome. So Dr. Garth, what does health disparities look like in your practice area of medicine, and how does a Black physician make a difference in improving that?
Sure. So I think if I was to think about it into different spheres, so one is clinical, right? That's what I do. When I go into the ER, I'm seeing patients at a high volume because our ERs are typically packed. On the south side of Chicago, they're majority African American. And then from a public health perspective, we're right there. We're thinking about violence as a public health issue. We're trying to think about how the social determinants of health affects those issues. From an academic standpoint, what type of research are we doing? What type of questions are we asking? Having an African American physician provides a different lens to approach research and ask different questions about some of the pressure points that are affecting our community. You can't understand infant mortality and get to that discussion section and think about the potential solutions to that community if you don't have a strong understanding of the cultural drivers related to the community. So getting more Black physicians and more Black academics in research to be able to be part of that discussion is really moves the discussion forward in terms of coming up with solutions from that standpoint. Majority, I'm the Senior Medical Director of Value-Based Care. So value-based health care is essentially an alternative to fee-for-service. Most physicians are incentivized by the volume of patients that they see. Value-based care's approach to thinking about quality and cost. So I have the opportunity to be able to align incentives that are targeted towards patients and how their lived experiences are felt. So throughout our healthcare system at Rush, we've put forth a health equity strategy as part of our health system strategy, which is very important because now you're thinking about how healthcare is run. And some of the innovation that we have put forth and some of the initiatives we have put forth is something as simple as putting social determinants of health screenings on the inpatient side and outpatient side.
Do me a favor, explain what social determinants of health
Sure.
is.
So the way that I think about social determinants of health, I think about the social and economic challenges that a patient feels in terms of being able to interface with our healthcare system.
So as an example.
An example could be your ability to get access to great foods, your ability to, the priorities you deal with in terms of feeling like, can you even get to that clinic? Right? Transportation. Do you have a job that has insurance?
Is your heat on?
Is your heat on?
Let's break it down.
Let's talk about
Is your cell phone cut off? Okay.
Lead, what's inside your home? All the things that play 80% of your ability in determining your health outcome. 20% is determined just on the hospital system. So we have to challenge ourselves to be able to think about all those issues.
Let's break that down. Rewind that tape. The medical care only really constitutes 20% of your health outcomes. 80% are about what keeps you from seeing a doctor, whether it's access to great care, whether you're having a family crisis, you have nowhere to live, you don't have food. All of these things are much more important on your what do I have to solve right now list versus going to a doctor or a hospital. So that's what's called social determinants of health. And that's what you deal with a lot in the emergency room when people show up. Because basically when you go to the emergency room, it's a crisis.
Yeah, I think one perfect example is say you have a family member that presents for chest pain. That could mean anything. It could be low risk or it could be high risk. Low risk might mean I have some chest discomfort, but
I had some bad rains last night.
Yeah, maybe you have some bad rains. But if you're 50 years old and you may have had a family history, you have to take pause and think about whether you want to be able to make sure this person can get in for a stress test. I know personally, when I practice, if I know the likelihood that that person's about to return within 48 hours is very effective, I'm more likely to admit that patient because it's better patient care.
So for people that you don't think will show back up to that doctor and their case is serious, and we'll go ahead and admit them.
And it might not be due to them.
Okay.
It might be due to where they live, the challenges that they're dealing with. And if that's a challenge, to be able to come back within 1 or 2 days for a stress test, to make sure that I'm close to 99% chance you're not going to have a heart attack within the next 24 days, that's going to be the art of medicine. And but if I'm on the North Shore, I'm confident somebody will come back. They might have a PCP, and they can give me that confidence. But a lot of times, our community doesn't have that privilege. And I think that's the difference between thinking about how we approach healthcare disparities and how we make sure that we think about approaching things that are very
and understanding people's lifestyle and cultural barriers and those social determinants of health. So you will go ahead and admit someone to make certain that they are getting that stress test that could save their lives. That's why you need a Black doctor. So that's what an excellent example. Really appreciate that. Dr. Crystal, in your practice area, what does health disparities look like? And how does seeing a Black doctor or having a Black doctor change that?
Well, the field of OBGYN is just full of healthcare disparity. We can just think back to because I'm a surgeon, right? I do female surgery, hysterectomies, taking care of women, etc. And I also deliver babies. And then that comes with all the prenatal care and things that can happen to patients along the way. Well, when you think about it, you may not know this, but a lot of surgical procedures are just rooted in evil when it comes to our community. For example, C-sections, they practiced on us without anesthesia. Okay, tubal ligations, they would just throw us in there, right? Tie our tubes, not caring if we wanted to have babies or not. Those are just examples of things that they did to our community so that people have a natural mistrust. If you look at studies and history, they're just full in all the journals of we have a disproportionate amount of hysterectomies done. They don't necessarily offer us always the conservative procedures that we could have because maybe our ability to populate isn't as valued, right? They don't want us to populate. It sounds bad, but some of this is true. Racism. And because of that, there's going to be an inherent mistrust. And so when you come in, patients are already wondering, oh, you're just trying to do this to me because of this or that. And so you have to break through those barriers, and I see it all the time. Pain medication, I've been on the floor. Black and brown people can be sometimes a little more stoic. If I say I'm in pain, I'm in pain. And I see nurses and other staff people necessarily sometimes not giving us the adequate pain management that we might need. So all of these things are things we have to tackle in day-to-day practice and make sure that things are equitable. So
maybe you could talk just why are so many Black women, pregnant women, are dying?
Well, that's a great topic. You know, there was an article, I think it was put out in 2020, and the article, not to go into great technical detail, it was Race Matters, I think it was in the American Journal of Obstetrics and Gynecology. It did a study in a military hospital, because a lot of times you wonder, like, okay, we do have a lot of people that live in certain communities, maybe that's why we're dying, because we don't take care of ourselves, etc. We may not have access to care. But so they chose a military hospital, and the reason they did that is because there's universal health care there, right? So no matter where you're from, you should have the same access to care. But guess what? When they looked at that study, the mortality level in African American people was still higher than white people or whoever else was in the study. So that means there's something else going on, and it's not, although yes, where you're from and access has something to do with it, there's something else. And so you look into and explore, what could that be? And some of it could be, and needs to be explored, a word called, or a topic called implicit bias. Now, what is implicit bias? In terms maybe we understand, it's something subconscious, right, bias, that let's say a person who's not black may have and not know they have. And so that's a hard subject to tackle, because some people, you don't want to think you have bias, and there are especially people in the white community that have biases that they either have accepted or not accepted. Until you explore the fact that for whatever reason you may not be listening to or taking into account someone's different culture and where they're coming from, we're going to have these issues and problems. So, I mean, it's a huge topic, but I mean, it takes self-exploration.
That's right. One of our, at MyOwnDoctor, we have care navigators, and she shares a very painful story. She was pregnant, but she was feeling pain. She went to a hospital downtown, big hospital that you know, and said, I'm feeling pain. And he's like, well, these are just pre-labor pains. And she's like, this is my second child. I know what labor looks like, feels like. This is not that kind of pain. No, it's pre-labor. Went home, still feeling the pain, intensifying. Her mother tells her, go to Cook County.
That's right.
Okay, went to Cook County, saw a black OBGYN. She listened, she's like, this is not pre-labor.
Right.
Turned out the mother had appendicitis. She's like, she was pointing to where the appendix was. This is where the pain, not to labor. For this woman, the black OBGYN, it was so clear to her. Well, she respected, this woman knows what it feels like to be in labor, and it's not labor pains. And it's that kind of, are they listening to black women and black mothers? Are you listening to them? Because it's irrespective of education and economics. So thanks for that. So Dr. Ansel, first of all, do you guys sell glasses?
Yes, we do.
Those are some sharp eyeglasses you got on. Brother, you are matching your suit.
We carry several African-American designer lines.
Awesome. Oh, wait, I
Good product placement, there we go. Good product placement. Just so you know that.
we promote black health and black businesses, so there you go. Tell us what health disparities looks like in your practice area, and how having a black optometrist helps with that.
Okay, let me start. Okay, we manage wellness in terms of your eyes. I tell people, we don't want to see you when the wheel falls off the wagon. My vision went bad, and now fix it. So when we look inside the eyes, that's the only organ we can actually see your live blood vessels without cutting into the eyes. So when I look inside a person's eyes, I can actually have a pretty good idea of your overall health, along with your medical history, what medications you're on, things of that nature. So healthcare disparities in our office, a lot of times people are saying, well, if you're living with diabetes, as long as we don't see a lot of bleeding or swelling in the back, that's what we'll see in a year. Well, we are able to intervene. We can actually see very small, minute, microscopic changes in the blood circulation in the back of the eyes with the technology that we have. So we monitor people a little bit closer, but I also talk to people about diet, exercise, so social determinant of health. It's hard to get out and walk. People, their safety concerns are just simple things. So I really work through people's lifestyle changes in your diet. And yes, that is related to your eyesight. I don't want to see people get injections in the eyes, which work very well with swelling from diabetes. It works very, very well. But if we can avoid that and help keep the back wall of the eye healthy in the circulation, that's going to decrease your chances of having your kidney dialysis, which is the dialysis centers are just blowing up in our community, amputations, things of that nature. So I'm kind of an adjunct diabetes education coach for my patients. So again, social determinant of health, a lot of times people are told, we'll see in a year, they don't see any, because you have to get your annual dilated exam. So again, we talk about things, well, can you work with, I show people an app that I have on my phone to do exercise in the house. You can't get out. Cardio, little simple, it's not rocket science, but little small changes in your lifestyle as well as diet. We have a not-for-profit that one of our physicians is really into nutrition, so we make those appropriate referrals, send them to a pediatrist. So we just try to be that way. On the other end of social determinants of health, because I do refer to surgical specialists, and I mentioned Dr. Davis here. If y'all don't take care of my people and they don't feel welcome in your office, I'm cutting you off. I have cut off a lot of surgeons that didn't treat my people right. So I'm the Eyecare gatekeeper.
That's right, that's right.
So also I mentioned my 93-year-old mom. A lot of our seniors have problems getting around, transportation. They have to depend on their children or grandchildren to get them places. And so if you're not flexible in your hours, say you may go to these big clinics or whatever, or corporate places, we're not seeing you. I will be flexible. My daughter's she's only off one Saturday a month. Okay, we'll find a way and we'll work her in so we can see your mom or your grandmother. So those are little things that we like to think that we do, helping people. Again, same thing with children. We're busy with our kids and they can only get in after school, so we try to provide some little flexibility and talk. And again, it's hard to be what you haven't seen. So I really enjoy. My whole staff enjoys seeing kids, so just so they can kind of see there's another career path that they might have thought of. I'll tell you a little story. I have a young man that we're an externship site for 5 different colleges of optometry. So I decided the very few African American students that come through optometry school, I want to be a port so they can see a practice that's going to mimic or look like one that they're going to have if they decide to go into private practice. So I have a gentleman that worked for me for 3 years as a tech, got into an optometry school program that I'm an externship site for. He's in his last year, #1 in his class. And he's going to come doing his last internship rotation through our office. So just like I was exposed to Plano, we're trying to play it forward. And it's that responsibility for all you guys. I'm really happy to be with people because we get busy in our offices. So it's really hard for us to get out, but it's a passion. And that's a part of being from the community. We have so many people that go to places and they see providers that have no investment in the community. They don't go to church with y'all. They don't hang out to school with you guys. So we're because we're from the community. I grew up in Robbins, so and blessed to be back here. So social determinants of health are also insurance plans that you have.
That's a big one.
We have a huge percentage of people that are on Medicaid programs, Medicare, Medicaid, that a lot of places do not accept. Or if they accept, you kind of push back on the, and I can't get in for 4 months.
Right.
That's the reality. And as I explained to people, it's economics too. I have a not-for-profit, but also my staff got to get paid too. So we understand that, but we do have some flexibility. I have connections at Cook, so somebody that has an eye issue, they need laser surgery, whatever, I can get them in a little bit sooner than they might get otherwise. There are corporate places that might give you a sheet okay, you need to follow up on this, and they give you all these places send you to with no direction. So what happens? Those people tend to like put that sheet of paper down, as long as they can still see, you know, it's not a priority, or they might miss that referral. So there's so many aspects that, again, having someone that looks like you makes a huge difference.
Makes a huge difference. So now, quality of life. And 3, it will encourage you to be more involved in preventive care. So you don't wait till the thing gets so bad, you gotta head to the emergency room, and you have fewer choices and options of how to improve your health. So that's important. But what you've also heard is that it's hard to find a black doctor, right? Come on, church, amen? Okay. It's hard to find a black doctor. So this is the last question I'll ask the doctors here. And if you guys can give me one, I'm gonna ask for you, each of you, to give me one recommendation. If they can't, first ask for a black doctor. Always ask for a black doctor. You have that right, ask for a black doctor. But if you cannot see a black doctor, then you have to really learn how to fight for yourself, advocate for yourself. So I'm gonna ask each doctor to give me one piece of advice on how those that are here with us today, what should they do to help advocate for themselves if they cannot have or connect to a black doctor? We'll start with you.
I would say just keep trying. Don't ever give up. When one door closes, several more open. You have to keep fighting for your right. Your health is your right. And so advocating for yourself, so if that means you gotta go up to some doors and knock on some doors to get some answers, then you do that, but you never give up the fight. Never give up.
So your advice is to don't give up.
Don't give up. Because I see a lot of people, when that one door closes, that's the end of it.
Right.
Like, I'm done. Yeah, right. They become very, very frustrated. But you can't. I understand you get frustrated, but you have to keep on.
So this basically is like going to vote,
Yes.
and they just got one voting place in your community, and it's just short hours. You have to stand in a long line. What do? We stand in that long line.
We make a plan.
We make a plan. That's what she's talking about. Don't give up. Do what it takes. Okay. Dr. Garth, what's your one advice?
My advice would be, think about your network and think about a physician, a black physician that you know, and ask them if there is a physician that they trust. And the reason why I think that it's important is because sometimes we don't have the benefit of time, and sometimes things can be very, very complex. And the more things become complex, the less there is somebody that can do whatever it may be. So it could be a complex cancer that you might have, it might be a complex presentation you might have, and it might be just one person, a few people within the radius of Chicago that can do it. But if you have somebody within your network that you can talk, like call me, and I'll be like, and just ask me, what do you think of this physician? I'll be like, I think this person's great.
That's a great piece of advice.
I think that's a practical way to navigate a healthcare system that's already short in supply.
So, can't see a black doctor because they're not available, or your situation is very specialized and it's only a few people. Ask a black doctor for a recommendation. And you, Dr. Ansel, made that recommendation that you send people to, send your patients to other doctors that you know are good and will take care of your people if you can. That's great advice, Dr. Garth. Dr. Crystal, what's your one piece of advice?
Ask questions at your visit, and then if doctors don't seem like they have the time, they don't look like you, because sometimes you get that they're very passive, then ask for patient information. A doctor should be able to print something for you about what they say you have or what's wrong with you in terms that you should be able to read. And so most doctors will be able to do that. So if you feel rushed or like, why would I waste my time, that doctor didn't spend time with me, then at least get that when you're there.
That's great. Actually, I hadn't heard that. My doctor does sort of automatically print out these forms, but now you can ask for that. Be proactive, like, can I have a printout explaining, what you're recommending or what my condition is? That's a great piece of advice. Dr. Ansel, what's your one piece of advice?
Talked about your network. Ask your pastor.
Amen.
Who he or she goes to. Or there's somebody in the congregation. A lot of churches do have health advisory boards or health ministries. That's one great place to start.
That's excellent. That's a great recommendation. And then I'll say, I've got a piece of recommendation. With the business, I'm gonna put my business hat on. If you feel like your doctor's not listening to you, ignoring you, dismissing you, whether it's a question or you come in and you're asking for a particular treatment, and he's not listening, he or she is not listening to you, ask them to put it in your record, what you've asked for. Then they get real serious, because that's lawsuit, okay? You get a completely different response. Say, you know what, I'd like for my question to be entered into my patient record. So that's a different conversation.
Hi, I'm Patty Davis. I'm a pediatric ophthalmologist and a neuro-ophthalmologist. So I'm one of those weird subspecialists. And the best question I've ever gotten from a patient is, if she was your baby, where would you send her? And I have sent children to Philadelphia, where I trained. I have sent people to Cleveland. I have sent them to the best people in the country for whatever's wrong with them. And if your doctor won't do that, get a new one.
That's
Thank you.
excellent. Yes.
This has been such a great panel. As everybody was speaking, it was making me remember stuff that happened to me when I was seeking medical attention. So I had a wonderful OBGYN, Dr. Nelson Stringer. I don't know if you are familiar with him. He practiced out of Rush, and he was a pioneer on less invasive way to remove fibroids. He was so arrogant, I loved it, because he guaranteed that I would have 8-pound babies, right? And he was like, I only deliver healthy babies and healthy mothers. With that being said, I followed him to the point of, if he did not take that insurance anymore, I would go and find me the insurance that he took, because he needed to be paid, right?
Right.
So I'm asking each one of you guys, doctors, excuse me, I know it's important that you get paid. Are the insurance companies paying you guys on time and giving you what you're worth? Because if you say it's $100, they're gonna give you $15. Also too, I don't want to lose you guys for malpractice insurance being unobtainable. I've had my pediatrician leave and go to Indiana because the malpractice was less. So can you address that, and please stay? What do we need to do, GoFundMe?
Who wants to take that?
I can wholeheartedly say no. That some of these insurance families do not pay us what we are worth. So there are some clients that I do see for free, because I know they don't have the out-of-pocket funds to pay for their counseling services. One person was like, you're probably going to have to write a letter to the insurance panel to kind of plead your case as to why you need this money. And it's funny because I'm like, why do I have to plead why I need, I always say we're out here doing the Lord's work. We're out here pretty much saving lives, helping people, talking people off the ledge, literally. But in most cases, we do have to write letters to the insurance panels to explain why we feel like we need a higher amount to be paid. But as of right now, certain insurance companies do not pay us what we are worth.
Addressing, I mentioned Medicaid, why it's hard to find a Medicaid provider because they probably pay about 25 cents on the dollar, if not less. And so I have staff to pay for it, staff work raises. It's just hard to maintain a practice. So that's a public policy issue we should really talk to our politicians about. And the other side of the aisle is going to fight that because, unfortunately, it's more white people on Medicaid than blacks. but because it's perceived that we are so much of that population, they don't care. So we really have to address that increase in reimbursement. I'm blessed to be part of a pilot program, and hopefully a year from now it'll work, where we are seeing patients with diabetes and they're giving us a little boost above what Medicaid is to see if that works in terms of access. But it is really about paying providers. Believe me, if they pay what Blue Cross Blue Shield pay, you would not have a problem with providers access.
At all.
But no, that's pretty much it. It's reimbursement in that respect. And so whenever they're looking at budget cuts, Medicare had a 2% cut just this year, and they were talking about doing an 8% cut. So how can we go forward? Even the 2%, 3% cuts every year. Who can take a cut in their pay every year? So it's about public policy, and we got to talk to our politicians and partner with them about it.
So when you go to the voting booth, these are the things that should be on your mind when you're casting your vote for whomever. Dr. Garth.
Sure. So as an ER physician, I kind of lucked out most of the time with not having to deal with those issues. That was one of the reasons why I chose the specialty, because we just treat whoever comes through the door. But naturally, so Medicaid is a state issue. So you're thinking about state leaders if you're trying to organize around the topic, Medicaid reimbursements to increase. But with respect to some of the models that we're testing out, one is called ACO REACH, which is a federal program that tests different reimbursement models. And the point of that is to increase the amount of opportunity that providers can get from taking care of folks that may be in certain zip codes that may be underserved. So there's different initiatives going on out there. We're partnered with CVS to be able to provide that type of access. And so it's just about kind of knowing what are some of the things that we can organize around and talk about and bring to the forefront.
Also, at federally qualified health centers, community health centers that are providing medical services will get higher Medicaid reimbursement. But the biggest issue you're talking about, who gets paid the least, are when you see Medicaid patients. And they're often, have dealing with all the social determinants of health, have higher barriers to their health, can be the most ill, and they get the least resources. The founder of MyOwnDoctor says that we get the most of the bad and the least of the good. Most of the bad, least of the good. So I hope today you understand why. We got a question over here. Yes, one more. Yes.
Not really a question, it's really a testimony. Thank you guys for doing this, because I can say that everything I go to, all my doctors, they look like me. Because I'm not going to get my greens and my chicken from anywhere. You got to know the season. You got to know what I'm putting in. So I have a testimony. I went to my eye doctor, and he was looking at me, and he said, "Have you ever got tested for pre-diabetics?" I'm like, "I'm diabetic? What are you talking about?" Sure enough, I went to the doctor. She said, "Yeah, you are pre-diabetic." So it does take a doctor that know these things, that can look and know the difference. And guess who my doctor is? My eye doctor, Dr. Ansel Johnson.
All right.
I thank you. Now I got a hold on that diabetes, and I don't have no pre-nothing.
Amen. I have no pre-nothing. I love that. It's a t-shirt. I just wanted to, I hope you have a better understanding why you should look at your health the same way you look at someone trying to take your right to vote. Police officers, overreaching and murdering our community, or miseducation and undereducation of our community. Your health, how you feel, is on par with that. It is a civil rights issue. Putting in a quick plug for MyOwnDoctor. We specialize in this. We do see Medicaid patients, And it's not just a matter of the access to care. What these physicians have talked about is the quality, what kind of care are you receiving? So we're focused on that. We work with CVS Aetna in Illinois. We're going to be working with all the insured. But for here and now, we've created a free, and I say free 99, okay, online community called Heart and Health. With Heart and Health, we provide a free, there's that free 99, weekly webinar with our mental health, mental and behavioral health providers, with our therapists. So every week we take on topics. You know, why are you stressed out? Is your family stressing you out? Okay. Are you feeling isolated? How is, you know, your finances impacting your mental health? We take this on in these weekly sessions, and our therapists give these practical assessments that you can take at home and downloads. Very practical information, but more importantly, you need to be heard and seen by people that look like you, that get you. And so I want to encourage everyone, sign up for this free resource online community. We also do free live cooking demos. We do free live medical webinars with our doctors and our nurses on heart health, on kidney health, on women's health. Free resource out here. You can also sign up to see one of our telehealth doctors. So basically, you can sit on your couch while you're watching TV, okay, and see a doctor from the convenience of your home. We also we have a CDC certified diabetes prevention program. We're now going to make this a free program. So sign up. There's a lot of reasons to sign up for this resource. We don't want anything to be a barrier. Not insurance, not Medicaid, not access, because you can do our telehealth. All you need is a cell phone. You don't need Wi-Fi. Just need a cell phone. It's Black owned, and the software was created and developed by Black people. So, this is, I'm sorry?
What's the name again?
The name is Heart and Health. So the name of the company is MyOwnDoctor, but the online community is called Heart and Health. And so here, wave your hand, Tamar, Shanika. They can give you the card where you can sign up. And we give away cool stuff, y'all. We give away movie tickets. We give away prepared food deliveries. We give away a lot of great stuff. And once a year, if you're active in this community, we're giving away a vacation for 4. Because we know that Black folks, we don't get enough vacation. We have a weekend, that's all we have, okay? We need a vacation. That has a huge impact on our mental health and mental wellness. So I just want to encourage everyone to sign up. It's so easy, really easy. Download the app. Type, if you got your phone, who has phones? Cell phones. Go on your cell phone and to the App Store or to the Google Play Store and type Heart and Health. Is that right? Heart and Health. Don't need to type partner, just Heart and Health. Download that app and create an account. Every Thursday at 7 o'clock, we rocking with therapists. We will get you on. So I'm going to ask you. So I'm putting you on blast. Okay. Right. All of you going to have you on. How about that? Got everybody's commitment. You witnessed their commitment to do this, right? So I just want to encourage you to do that free resource. And we're there live every Thursday. We do special events. We're here with the Urban League. I have a heart for the Urban League. Once an Urban Leaguer, always an Urban Leaguer. And the work that the Urban League is doing is just tremendous and invaluable. So I'll end like I started. Do you have a right to feel good? Yes. Well, I need for you to claim that right to good health by reaching out to your physician, get involved in your preventive health assessments, do your annual visits. My mother was complaining to me just the other day. These people call me, they want me to come once a quarter. This is a racket. Why do I have to go and get a checkup once a quarter? I'm like, Mom, okay, your son is an MD, PhD. I'm running a telehealth company. We need for you to do these doctor's appointments. We know it can be inconvenient, but this is just like sometimes voting is inconvenient, but we do it. And we need to do more of it because of issues like Medicaid not paying our doctors enough to take care of you. So with that, I think we're done with Q&A. Thank you for this opportunity. Give a round